Hello, I'm Dr. Joe Ritola with Airrosti, and today we're going to talk about lower cross syndrome. We're going to start out by talking about the causes of lower cross syndrome, the signs and symptoms that would let you know if you had lower cross syndrome. We're also going to talk about how traditional healthcare handles this and how Airrosti is just a little bit different. Let's get started. Lower cross syndrome occurs when there's an imbalance that exists in the muscles in the lower part of the body, with the abdominal muscles and the glute muscles becoming too weak and overstretched, and with the hip flexor muscles becoming too tight and shortened. Now let's talk about some of the common causes of lower cross syndrome. While it's true that poor posture is at the top of the list, other things can contribute as well, like having an overall inactive lifestyle or sitting for long hours in front of the computer. What's more, lower cross syndrome can actually predispose you to even worse injuries of the lower back if not properly addressed. Some of the signs and symptoms that indicate that you have lower cross syndrome include discomfort in the glutes, hamstrings, lower back, and in the hips. Most of the time, this comes across as a loss of range of motion, stiffness, tension, and a dull, achy pain in these areas. Now let's talk about how traditional healthcare providers typically handle the symptoms of lower cross syndrome. Oftentimes, they'll ask their patient to rest and to avoid the activity that seems to be aggravating the symptom, and oftentimes they will also prescribe medication, including anti-inflammatories and sometimes steroids. Now let's talk about how Airrosti is a little bit different. First, we perform a thorough evaluation, which helps us arrive at a proper diagnosis so we can get to the root cause of your pain. Airrosti focuses on correcting the dysfunctional connective tissue by manually repairing it to its normal state, either through hands-on manual therapy in clinic or through provider-guided self-myofascial release through our Airrosti remote recovery platform. We follow this up with an active care program with specific stretches and exercises you can do at home to help you increase strength, improve function, and normalize range of motion. All of this is geared specifically to help you quickly return to normal activity. We hope the information presented here was helpful to you. If you or someone you know is suffering from lower cross syndrome, reach out to Airrosti. We'd love to help you. You can schedule an appointment by clicking here. We have in-person and telehealth options. You can click here to view more videos, and don't forget to subscribe to our channel. Thanks very much, and we'll see you at the next video.